Today we'll be talking about the gluteus maximus. The origin point for the gluteus maximus is going to be on the posterior sacrum, the ilium, and then the gluteal line, while the insertion point is going to be on the gluteal tuberosity and the IT band. The muscle belly is right here. You can palpate it here. The action of this is going to be hip extension and abduction with a secondary action of medial and lateral rotation of the leg. To test this muscle, what we're going to do is we're going to ask the patient to bend their knee, and then I'm going to instruct the patient to bring their foot up to the ceiling, and then while they do that, I'm going to make sure that their thighs stay parallel. I'm going to instruct the patient to hold for 5 seconds while maintaining that the pelvis does not come off the table. Ready, go. 1, 2, 3, 4, 5, relax. This patient would receive a 5. We'll now be talking about the gluteus medius. The gluteus medius's origin point is going to be on the iliac crest, and then as well as on the ilium between the superior and middle lines of the ilium, as well as the greater trochanter. You feel the muscle a little bit in here. The action of this muscle primarily is going to be abduction, as well as internal and external rotation. To test this muscle, you're going to instruct the patient to bring their leg up, and externally rotate their foot out while maintaining inline stabilization from the head to the shoulders to the hip to the feet, one straight line. You're then going to hold the pelvis there and hold here and instruct the patient to hold for 5 seconds. Hold for 5 seconds. Ready, go. 1, 2, 3, 4, 5. Relax. This patient would receive a 5. We'll now be talking about the gluteus minimus. The origin point for the gluteus minimus is going to be on the posterior ilium, as well as in between the ilium on the middle and inferior lines of the ilium, while the insertion point is going to be on the greater trochanter. To perform this manual muscle test, you're going to instruct your patient to stay in one line from the head to the shoulder to the hips to the feet, and then you're going to instruct the patient to bring their leg up in abduction, because that is the primary function of the gluteus minimus. And then you're going to hold here on the hip and hold here on the foot and say hold for 5 seconds, hold for 5, ready, go. 1, 2, 3, 4, 5, relax. This patient will receive a 5 for this manual muscle test.
Alright, so you're going to be doing the adductor muscle group. So for this group, first we're going to have the gracilis. This muscle originates at the anterior pubis, and it inserts at the pes anterior. The main action for this muscle is going to be hip adduction. Next is going to be the pectineus. This again inserts at the anterior pubis, but the insertion for this one is going to be at the posterior portion of the femur, between the lesser trochanter and the linea aspera. This muscle is going to do hip flexion and also assist in hip adduction. The next muscle is going to be the adductor longus. Again, it's going to insert at the anterior pubis, and it's going to run along into the linea aspera. The action is going to be hip adduction. Then for the adductor brevis, it's going to be a shorter muscle belly. It's also going to insert at the anterior pubis. It's going to run along to the linea aspera, and this belly again is going to be shorter than the longest. Then you have the adductor magnus. This is going to be the biggest of the adductors. This originates at the pubic ramus and ischial tuberosity, and it runs along the femur to the linea aspera and the attaches at the adductor tubercle. The action for this muscle is going to be hip adduction and internal rotation. So to do the manual muscle test for the hip adductors, you have the patient come on the side, on the uninjured side. There we go. You're going to have them straight. You're going to have push this leg over across. There we go. You're going to stabilize at the pelvis. You're going to have them lift up this leg. I'm going to push down. Now I'll have them hold for 5 seconds. Ready? 1, 2, 3, 4, 5. Relax. This should be a 5 out of 5 test.
The first muscle I'm going to be doing is the iliopsoas muscle, which is comprised of the iliacus and the psoas major. The origin of the iliacus is going to be the iliac fossa, which is not palpable, and the origin of the psoas major is going to be T12 through L5, which is on the spine, and that muscle is going to come right here, and it's going to come up and around. The insertion for this muscle is going to be the lesser trochanter, which is also not palpable, and the actions are hip flexion and medial and lateral rotation of the femur at the hip joint, So to do this manual muscle test, we are going to lift his leg and externally rotate. And he's gonna hold that for 5 seconds while I stabilize him at the hip. All right, ready? Go. 1, 2, 3, 4, 5. Relax. This patient will receive a 5 out of 5 for the test. So the next muscle I'm going to be doing is the tensor fasciae latae. The origin is going to be the iliac crest, which is right here. The insertion is going to be along the IT band, Gerdy's tubercle, and the head of the fibula, which is right here. The action is medial rotation, knee extension, and flexion. And to this manual muscle test, we are going to lift his leg and internally rotate. And he's going to hold that for 5 seconds while it stabilizes it at the hip again. Right, ready? Go. 1, 2, 3, 4, 5. Relax. And this patient would also receive a 5 out of 5 for the test. So the next muscle group I'm going to be doing is the deep 6, and these are all on the posterior side, and these are all lateral rotators. So to test this muscle, I'm going to have him externally rotate, and he's going to hold that for 5 seconds as I resist. Right, ready? Go. 1, 2, 3, 4, 5. Relax. And he will receive a 5 out of 5. The next muscle group I'm going to be testing are the medial rotators, and these are comprised of the gluteus medius, gluteus minimus, and the TFL muscle. And to test that, we're just going to have the patient internally rotate, and he's going to hold that there for 5 seconds as I push him in. All right, ready? Go. 1, 2, 3, 4, 5. Relax. And he will receive a 5 out of 5.